Welcome to the Healing Circle. Stop. This may cost you your life. Today we're going to talk about a word, and that word is triage. Now, in medicine and in emergency rooms and disaster zones, this word is used very often. But in life, this word applies so that we can learn to make the most important decisions first. Now, when a patient enters the emergency room, the patient is met by the nurse, the physician, or the medical personnel. That individual has to make a decision, and to make the decision in an order, a certain order, and with a sense of urgency. So order and urgency. The decision that is made is regarding how quickly that patient is going to be dealt with, the level of care that the patient is going to receive, and also the type of speciality or specialization that that patient demands. Now, let us stop and look at all of that, and let us really honor clinical intelligence. Because many of us sometimes, we would go to our counterpart or to our family members or someone that we think, has well wishes towards us. And we'll ask them about how to make decisions regarding our health or other areas in our life. Now, many times the decision can be made in a way that the problem is minimized, or they may exaggerate the problem. None of those decisions are good. They are both dangerous. So, when we walk into a clinical space for medical attention, there is an individual there, the doctor, the nurse, or medical personnel, who has a certain amount of clinical intelligence, and we want to stop to honor that today and to thank those persons for serving us. Now, we have a responsibility in our own lives to decide things that are happening in our lives and how we should deal with them expeditiously. I'll give you a quick story. There's a young lady, she had a 6-month-old baby or thereabout. In the midst of just giving birth, after that, she was slapped with a divorce from her husband and with a diagnosis of cancer. And guess what she had to do? She had to make a decision to prioritize her health because her young baby depended on her. Other family members were depending on her for economic support, and so she had to make a decision to preserve her life, because if her life had stopped, then everything else would stop. So today, let us consider what it is to do a good triage, and that is to prioritize that thing that needs to be prioritized, to make the right decision, and to listen to not only the trusted source, but the source that has the clinical expertise in whatever we are. See you next time in the Healer's Circle. This is Dr. Wilda Mills.